Hello, everybody. Welcome back to Two Bye Guys. I think you guys are going to love this episode. It's about one of our favorite topics that many of you listeners identify with. Today, we're going to talk about mixed orientation couples. And my guest is Joshua Gebhardt. He is a licensed marriage and family therapist in the Atlanta area. And he specializes in working with mixed orientation couples. In fact, his 2024 dissertation is titled The Experiences of Counselors Working with Mixed Orientation Couples. And he also leads multiple support groups, including one for women who are married to queer men, which I found fascinating and which we will talk about, and lots of other stuff that we'll get into. Welcome to Two Bye Guys, Joshua Gebhardt.
Hey, thanks so much. Glad to be here.
Yeah, I'm very happy that we connected. The most popular episodes of this show have been the ones about mixed orientation couples and specifically bisexual men married to women. And that's what I wrote my book about. And yet we haven't really had the counseling perspective and someone who works with a lot of these actual couples. I work with a lot of these men, but not couples. And so I'm very excited to hear your point of view. Welcome.
Yeah, I mean, for sure. I mean, and it's not surprising to me that you haven't had that experience because I don't think there's a ton of counselors out there doing this work.
Yeah, I know that because I just received a request to be referred to someone who specializes in this. And like you came to mind, and that's great. But like he didn't know where to look. I didn't know where else to look. Thankfully, we had met recently and I could refer him to you. But there are not a lot of resources, and there are a lot of counselors and therapists who do not know how to navigate this at all.
Absolutely.
Your
Absolutely.
perspective today will be valuable. And also, I introduced you incorrectly. You just completed the PhD, so it's Dr. Joshua Gebhardt, in fact.
Yes. I don't think I'll ever make a victory lap on that one again.
Well, welcome, doctor. My apologies. Okay, so I in a little bit I want to hear your story too, but let's like start with the basics of this. And like your dissertation is about mixed orientation couples. What is a mixed orientation couple? How do you define it?
Yeah. So, and again, I apologize if my answers today are like really lengthy. I am a therapist, and so I don't get too often of a chance to talk myself. So, uh,
Amazing.
yeah, but I'll try to make it concise. So, historically, if you looked at like what a mixed orientation couple is, some of the research dates back to like the 70s and 80s. But at that time, mixed orientation couples were really seen as like heterosexual couples, where the husband was in some ways acting out sexually with other men. And then as the 80s and 90s approach, and even until the early 2000s, you start really getting into like, society starts understanding more things around identification and the importance of that. And the definition kind of changes and shifts, just a little bit there. But in present time, we would say that it's a couple in who has at least one partner or spouse that identifies as something non-heterosexual.
Cool. And like it is interesting. I mean, maybe we'll get more into this later, but it is interesting that like you went right to where the man is the fluid one as opposed to the woman. Like it could be both ways, but why is that like sort of your focus, it seems?
Yeah. So, I mean, historically, if we look at the experience of queer or lesbian women, men didn't, or society didn't really even give them a chance to like identify, that this was an actual identity. And, it really was not given too much credit if, a woman experienced some type of bisexuality or was actually a lesbian. And and so, you know, with that history being there, like, ultimately, I have worked with a range of couples who it's mostly the man that's struggling with this. I'm
Hmm.
positioned in the South, uh, in Atlanta, and there's a lot of religious and conservative groups here, and so, you know, I just have had the experience of mostly seeing men. It's not to say that it doesn't happen with women, but my practice is just really focused on that. Um, yeah,
Yeah. I mean, there may be many reasons for it. And I don't want to judge everything based on gender, but it does. My experience has been like when it's the queer man with a woman, that is a particular struggle. There are particular challenges where, and like not as much resources or support for it. And yeah, the other way around feels like it's more common and accepted and understood in some way. I don't know, maybe, and or maybe the women are less interested in exploring outside the marriage, and that's maybe why there's less conflict. Okay, but let's get into that
well, I mean,
conflict and
it
maybe the yeah. Go ahead.
just to speak to that, like,
Yeah.
I mean, if we look at prevalence rates of bisexuality amongst men and women, um, you know, it's much bisexuality is much higher in women. Now,
Hmm.
again, I'm sure you can speak to this, but like, uh, I would say a lot of that's culturally and how society has kind of like conditioned the experience of same sex engagement. Um, for a lot of straight men, uh, same sex engagement between two women is something that is not taboo. It's actually
Right.
enjoyable. Whereas, you know, when two two men are engaging sexually, that's has a little bit more of a negative connotation culturally.
Right. Right. If a wife comes to her husband and says, "I want to explore with another woman," it's just like this like we have this obvious natural reaction that is definitely culturally ingrained. That's like, oh, hot. But when it's the other way around, and a guy wants to be with other men outside his marriage, you can just almost feel the tension without even having to go any further than that. Um,
Absolutely.
so your intro to your dissertation says these mixed orientation couples face distinctive challenges that result in high relational distress and low relationship satisfaction. We're going to talk about how to navigate that, but can you tell us like what are some of those distinctive challenges?
Yeah, I mean, I think before talking about that, like, it's really important to discuss um, like there are mixed orientation couples that do experience moderate to high levels of satisfaction. I'm just not seeing them in my therapy sessions because
Hmm.
you know they're they're not distressed.
Right.
And I think that that's one of the reasons why I focused on the man's experience, or the husband's experience, um, was because those were the couples that I saw mostly struggle. Um, and so those couples were you know coming into therapy, and uh, they're just highly traumatized when they come into session. Um, like, most of the time, sexual or a sexuality that's disclosed, that's a non heteronormative sexuality, is oftentimes seen as like a betrayal or an affair. And so you're getting
Mm.
couples that are coming into session just, again, traumatized. Both of them are traumatized. Um, they, maybe somebody, uh, there was affairs involved, or uh, the wife found an email chain or received an anonymous letter from somebody about her husband's work travels. But the couples that are coming to me have not talked about this openly. And I would say, most of the couples that you know do just fine after disclosure have typically arranged their marriage to be some type of non-monogamous agreement in the beginning that they've talked about, they've planned for, as maybe a potential option over the course of their relationship. But most of the couples that are coming in to work with me in session are heteronormative presenting, and have agreed to be in some type of monogamous relationship. And again, the non heteronormative person, the queer person in the relationship, in this instance, the husband, again, is either have just been found out through an affair, or is beginning to have a questionings of his sexuality. But regardless, all of those instances are seen as really traumatic for both people.
Mm. Yeah, that makes sense. And like, even in the cases without infidelity, even just the non-disclosure can feel like a betrayal, right? It's like, oh, if you knew,
Absolutely.
when did you know this about yourself? If you knew this, why didn't you tell me? Because that, that what is a partnership or marriage, but like being able to share this stuff. Do you see that too, even without infidelity?
Oh my gosh, absolutely. I mean, it's the notion that, like, if you have the attraction or if you have the feeling, then you're cheating on me.
Mm,
And then you add the layer of it being taboo because maybe the husband's gay or bisexual, and that forces, unfortunately, the wife into this position of feeling betrayed, uh, feeling like she's kind of been just like bulldozed with this information, or deceived in some ways. That her husband hasn't shared this really really intimate detail with her prior to this point. And again, these are couples that have been together some of the times for 25 to 35 years. They have kids, they've established a life together, their community is shared amongst them, extended family is involved. And so the disclosure of this just marks such panic, because it's almost like before you even you know uh, do any kind of therapy, the couple's already kind of like predetermined, like, our life's over.
mm,
This has got to stop, this has got to end, and there's no way forward.
mm. Interesting. What do you work on them? I mean, we'll get I don't even know where to go next, but what do you do in that situation when you have a couple like how do you navigate that with them?
Well, I mean, I've been doing this work long enough that I can be a little bit or a little cynical and be like, well, y'all need to go find a therapist, because I don't know what's going to happen here. But
Uh,
obviously not. I'm not saying that. I'm very empathically engaged with what's going on at the moment. But I say that joke because, like, it is so distressing. And we'll talk about my research in a little bit. But, like, that was the issue of why I wanted to study this, was because nobody was talking about it. I mean, even in the clinical
yeah.
community, there's no handbook, there's no manual, and so for some of the therapists and counselors that I interviewed and studied, I mean, they talked about just not having any resources. They had never seen this before, and they surely didn't know what to do when that
Yeah.
happened. Again,
Mm,
it's panic all around, and the unfortunate part about that is when a couple's seeking therapy, you would hope that the therapist has at least enough grounding where they don't panic too.
yeah. That makes sense. Oh, we'll get more into that and the counselor perspective
Sure.
on it and how that affects them. How long have you been doing this, by the way?
Oh goodness, about a decade now.
Wow.
My
Cool.
research has on mixed orientation couples goes back to even my master's, or my graduate degree in marriage and family therapy. I completed my thesis on that too. Um, so I mean, I've been doing this for about a decade now.
Interesting. So you listed some of those challenges, like the disclosure of sexuality or of like what's been going on, the potential either extramarital affairs that have already happened, or the desire to explore this and open up marriages. There was another one in there that I thought was interesting, which is like sexual functioning being a concern. Can you talk about that? How what that looks like?
Yeah, yeah, yeah. So I mean, again, this is generally speaking. These are these are couples that are presenting for therapy. These aren't couples that necessarily have prearranged poly relationships. These are heteronormative presenting couples. But those couples, when they present, or key characteristics of their relationship is, again, it's some type of low relationship satisfaction. They're having difficulties with sexuality or sexual functioning. Uh, there's likely, some type of difficulties with extramarital involvement. And unfortunately, these couples can tend to divorce really, really quickly once disclosure
Mm,
happens.
mm.
So those are kind of the common characteristics that you'll see in therapy. But more so than that, like, that's what we're working on. We're working on the aspect of the disclosure of sexuality. Uh, we're looking at how to navigate relationship boundaries, and we are looking at how the couple's going to function as a couple sexually.
Why do you think that happens, that sexual functioning becomes an issue when this comes up?
Yeah, because I just would say, like, the couples that I've seen struggle with the the understanding of what sex means in their relationship, not just simply because there's some type of, like, sexual preference differences, but, like, there is genuinely a new identity that's presenting itself in the relationship. And so it just creates and houses this whole new, like, world in some ways. And again, because you know sexual identity is so core and to who we are. I mean, both individuals are just really seeing this as a almost like an immovable object. Like, and you'll hear these couples say things like, you know he's either gay or he's not. Like, like, what's the answer here?
Hmm.
And counselors just go, they just panic. But again, it's because they are just so traumatized by the fact that, you know I'm not gay, or I'm not straight, and my husband's not straight. And I mean, maybe I'm getting a little bit too far off on a tangent here, but there's oftentimes not the or the husbands per se. The wives also have this difficulty, but the husbands some of the times are coming into session going, "I'm not gay. I you know I have sex with men. I watch porn with only men in it. I think about men. I dream about men, but I'm not gay." And so it's difficult for a counselor to, like, see all these kind of sexual behaviors and expressions, but just such a resistance to even identify as gay or bisexual.
Oh, as gay or bisexual. So that's the
Absolutely.
interesting part, is like you mentioned, like, oh, you're either gay or you're not gay. And like my mind is like, no, you can be somewhere in the middle, of course. And like many people just are not aware of bisexuality or don't think it's a thing. So like when the guys come in to see you, is that something they're struggling with? Like, am I gay or bi and how do I know?
Yeah, I had a one of my colleagues, and also somebody that I uh, got to know through the research that I did, talked about how, like, the intake call for the couple. Uh, she talked about how the husband said, "Hey, we can do therapy together, but you just need to know I'm not gay." And there was just, like, no questions asked. Like, there was just no willingness to even identify with that, when there was just, again, such a discrepancy between his identity and what his sexual attractions and behaviors were. Um, yeah, so I mean, it's difficult because the husband's experiencing that, while on the other end, the wife is going, "Okay, let's figure this out. What's going on? Like, we need to know something." and
Uh-huh.
and, again, there's just so much pressure to figure out everything all at once in the beginning of things.
Yeah. Interesting. I'm gonna dig into that for a second. Are you saying like some of the guys, when they're saying like I'm not gay, are they kind of like maintaining a straight identity to maintain the marriage and then kind of trying to expand the bounds of straightness? Like I'm straight and I just like this thing for these other reasons. It's not part of my sexuality. It reminds me of like Joe Court. I don't know if you're aware of him, of who
Hmm.
I have some issues with, but is that kind of what you're saying? And are they just like ignoring the possibility of bi and working within this binary idea?
Yeah. I'm really familiar with Joe's work. He's a colleague of mine. I spoke to him several times, and you know, for the most part, he's written the most comprehensive book there is on it. And I think the title of the book is "My Husband, Gay, Straight, or Bi,"
Yeah.
and I mean, I think it was published almost 20 years ago. And
Yeah.
so even though as comprehensive as it is, like there's just not a lot of resources out there to understand this. And so, what I'm suggesting is that most of the time there is just a discrepancy between how the husband is attempting to identify and hold on to, some of the times in a desperate attempt to maintain this heteronormative straight identity, whereas there's almost this whole entire other life that, one, he's never unpacked or understood, and all of a sudden it's bleeding out into his everyday life and now his marriage. And the person that knows him the best now knows this piece of information that he has to kind of come clean about. And so I would say most of the time it's about preservation for sure during that initial stages of panic.
Hmm. Interesting.
There's one of the counselors in the study that I did, talked about one of the couples that they saw, and just kind of a general theme of how couples act at this stage. And he said, it's like couples almost like come in and say like, hey, we've got to like change his sexuality, but we like can't get a divorce. Like that's not going to happen. So they put, changing your sexuality on the chopping block rather than maybe understanding the the context of how their marriage is existing. And again, if I could, like, these couples have 20 to 30 years together of a life, and then all of a sudden something like disclosure of an affair or sexuality being something that's not straight. I mean, it just drops a bomb in their life.
Yeah. Wow. One of the things I hear people ask, like when I work with them, or I was just at this How conference. It's a conference for husbands out to wives. Is like, just like what's going to happen, and we'll get into like how you figure that out. But you had like a kind of a statistic in there of just like basically there's three buckets of what can happen, and it's roughly a third of the time these three things happen. Can you share what those are,
Yeah,
like the
absolutely.
outcomes? Yeah.
Yeah, and just to be really clear, this information or statistics comes from um, research that was done like back in the 2000s, and the statistic came from like 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 an online forum or a message board for this. And so,
Okay.
like this is not like actually something that like we sat down 1,000 people and looked at this. This is just kind of like uh, qualitative data, but to some degree. But it is quantitative in the statistics portion of this, because what the researcher found was about a third of these couples divorce really quickly, and then another third typically stay together for about 2 to 5 years and then divorce, and then the other third stay together
Hmm.
and don't divorce.
Yeah. Interesting. I wish we had amazing up to date data, like especially as this stuff is becoming more known and
Hmm.
understood. I really wonder what like the data is, but that's an interesting, at least one point of data, and kind of makes sense that, like, I mean, just of among people I've met and know and people at this How conference, that kind of feels right, that like about a third will navigate it and stay together, about a third will just, they're done when this happens. You do see that a decent amount, and then probably another third work on it and ultimately decide they're not meant to be together. And sometimes it's not even because of this, but sometimes this, what I've seen is like opening this door leads to a lot more authenticity and vulnerability and really communicating about tough things. And sometimes that can lead to like a realization that they don't want to be in this marriage for other reasons.
Mhm.
Or just like the fact that this is difficult to navigate. It's not the thing itself, but it's the meta communication that causes this realization. Um,
Yeah,
so
I mean,
that's a really interesting
absolutely.
group. Yeah.
Yeah, for sure. And I mean, I think we're talking about all the negative parts of these relationships right now. And I mean, unfortunately, I mean, that's just what is, you know, faced for counselors working with these couples in therapy
Yeah.
sessions. But the one saving grace that came up for me was in in the statistics and in the data, these couples were reporting that they were seeking counsel. And so, when I was looking at this, I was like, okay, oh my gosh, like there's so much difficulties for these couples, but they are going to therapy, so, you know, what's happening in the therapy session? What's being done
Mhm.
to work with these couples?
Yeah. Okay. Perfect segue. That's what I want to get into. But just like to put, I'm glad you mentioned that because it often does feel like doom and gloom, especially when you like are in counseling or go to message boards for support or go to a support group. And it is important to remember that like those are the people posting on a message board are the ones struggling with it. And that's why they end up there. And there may be a whole bunch of people who navigate this really well because they communicate well and they love each other and like they're not seeking support. So how do we know they exist? And like I definitely have seen couples where they come out, maybe it's hard and they have to navigate this, but it opens up new pathways of communication. They get more intimate with each other because they're sharing themselves more deeply. And like it can be this amazing experience. So who knows how many of those are out there that are just not, we don't see it.
Absolutely, absolutely.
Yeah.
I mean, well, yeah, we'll get into the more of that, but absolutely.
Yeah. Cool. Okay. So let's transition to talk about like what your dissertation is about and the importance of like the experience of counselors working with these couples. So like you wrote that there's a significant lack of understanding of how counselors work with mixed orientation couples. There's very little research on their experiences in couples therapy. So like what have you learned from interviewing and researching these counselors or your own work? Like what do you want to share about their experience?
Yeah, I mean, first off, it's hard to operationalize success in couples therapy, regardless. Whatever type of relationship it is. Like, how do you actually like tell a whole group of people that like therapy's been successful? It can really be subjective around like how the couple's approving and what it is that is their goal. But I think that also lends itself to why studying this was so difficult, because what's a marker for success for these couples? Is it
Yeah.
is it relationship preservation? Um, is it living authentically? I mean, it it's just a challenge to actually identify what that is.
Yeah. That's an amazing point because like at least with a lot of people I've met, you tell me if this is your experience, but like initially relationship preservation seems to be like the first goal, but then that can often shift, and many of the people who are like really happy in the end up splitting. And sometimes I've even met people, there was someone in my book who's been on this podcast who like has a better relationship with his wife now that they're divorced, and they're still
Yep.
friends, they're still co-parents, they are more intimate and authentic than ever. They just don't live together and they're not married.
Yeah, yeah, absolutely. Which again, I think contributes to why mixed orientation couples have kind of been left out of the equation for what goes on in couples therapy, because it's just such a vastly different way to understand a relationship. And so, and again, I'm excited to talk more about the dynamics and the forces that play into that. But you know, again, there wasn't a ton of research out there, um, and personally, because I was in a mixed orientation relationship um, at the time that me and my ex-wife sought therapy. I mean, and I'm not trying to exaggerate or be hyperbolic here, but like, I mean, I think we went to probably about 10 different people, either as a couple or individually. Um,
Wow.
you know, support systems like, uh, our pastor that married us, people that we knew from our past that were, kind of like spiritual or religious, um, like mentors. We sought professional help. We went to a couples counselor that was referred to us by a family member. Uh, we went and sought our own individual therapist. I spent time with her therapist, and the unfortunate part about this is that I don't think any of um, those support outlets were actually really helpful. I mean,
Hmm.
there was experiences during that time where I recall like speaking to religious leaders, and one person in particular said, "Hey, if you want your gayness to go away, like I can do that for you." And I had even I even had like you know I remember this one time being in couples counseling where me and my ex-wife came into the session and we're obviously both just so overwhelmed. The counselor, I mean, his eyes are, huge. He doesn't know what to do. It's 15, 20 minutes into the session. He just said, "Hey, can I just speak to you individually?" Talking about me. Um, and he separated me and he looked at me and said, "Are you gay?" And I said, "I mean, I don't know." He said, "Because if you're gay, I really can't help you." And, we
Wow.
dialogued about that a little
What?
bit. And then he brought my ex-wife back in and he was like, "Well, it was good seeing y'all. We'll be in touch, and just send us on our way." And so it was instance like that time after again where, I mean, this is my own experience, but, I would have hoped that us seeking support during that time would have helped preserve um, our relationship in some way and it not be so conflictual. So, again, I read this in research, but it's also just something personally I dealt with.
Wow. Yeah, I want to hear more about your whole story in a few minutes. That's insane to say. Like, if you're gay, I can't help you. Like, that. I mean, just the like, what is a counselor or a therapist if not like follow the
Mhm.
client's lead and navigate wherever they are and wherever they want to be? Like, that's that's crazy, and it's very judgmental to like assume that you know the what the goals are that you had or like and what that means even to be if you
Mhm.
were gay within that relationship. That's wild.
Yeah, 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 absolutely.
I'm
I
rolling
mean,
my eyes and crossing my arms at that.
but I mean, again, this is, this isn't like decades and decades ago. This is more of a recent experience for me, and so, I would have thought that there would have been much more education around this. I kind of,
Yeah.
because I grew up religious, I kind of assumed what I was going to hear in those religious settings, but for the professional community to say those things, it was upsetting.
Yeah.
I mean,
Yeah.
uh, one time we met as a couple with my ex-wife's individual counselor, and again, the same thing. Told my ex-wife, "Hey, can you just go sit out in the lobby and waiting room and let me talk to him?" And she just downloads and she's like, "Josh, I knew you were gay the first time I met you."
Hmm.
And here I am going through, just uncovering parts of my sexuality for the first time, and you know, I'm like, "Well, I mean, thanks for telling me. Like, I'm glad you know now." And so again, those kind of experiences were just they were harmful for me, and I think again it made it difficult for us to navigate that part of our relationship.
Yeah, totally. That many people have told me that that response, like, "Oh yeah, I knew all along." It's just like not helpful. And it's even though it's like I mean, it's just kind of judgmental and brings up a lot. I can't believe I forgot to ask you this at the beginning, and we'll get into your story in a minute, but like, how do you identify your sexuality?
um, I identify as queer. Um,
Cool.
I think in most spaces I would share the term or identifier as gay, um, but queer feels most appropriate.
Cool. Okay, we'll get more into it in a minute. You also mentioned like couples therapy versus individual therapy. What was your research focused on, and like how are the experiences of counselors different from those two modalities?
Yeah, so I mean that was something that I had to operationalize and say, look, I really only want to work on studying counselors that have worked with a couple in therapy because individual counseling is very different. Um, and so couples therapy is is obviously going to include both both partners or both spouses, and some of the times, and this is a common thing to do, but um, a couples counselor will split up the couple and meet with them individually some of the times because some of the times you have to do that. And I would say like my experience of being split up in the session was not helpful. I'm like, why are y'all telling me all this? Like, why are we not talking to as a group about this? I'm trying to figure out this just as much as she is, and so um, you
Hmm.
know I would say that unfortunately some of the times though the reason why you need a combination of both is because generally the first part of a treatment is just education, like really getting to the understanding like what's going on in the relationship and how do we understand sexuality, because again there is just such a dissonance between understanding sexuality, one from a basis of like even if somebody's been in a relationship for over 10 years and they have they've never been with somebody of the same sex, and then all of a sudden they have one offhanded experience, and then their identity starts unraveling. And so even for somebody like that, a counselor is kind of tasked with the beginning of session to really kind of educate about sexuality. And you know this, that there's just so much nuance within the biology of sexuality that it can be difficult to understand uh, the full spectrum of sexuality, especially within only 45 minutes or an hour. But there are some things that we can kind of hang our hat on. And I take this from Joe Court's work, but he talks about this beach test. Um, and the beach test is just essentially like, if you're sitting on a beach, who are you typically looking at? Is it men or women? And it seems like such a simple test, but if you look at the biology behind that, like, uh, and again, there might be some new research or some of that argue with me about this, but like men are typically visually stimulated, and so you can typically see where a man's eyes go. What it is that they're interested in sexually. We've looked at studies about this. Um, you know, Straight men typically are looking at the chest, and gay or bisexual men are oscillating between that and the growing region. And I share this because again, you as a counselor, you have this man who or husband who is just confused, and they don't know. There is a need for general education about that. So again, a lot of that is just educating at the beginning, like getting down to some type of orientation. You take kind of like a little bit of a sexual inventory and how they understand how their sexuality is developed. Because again, there's so many people that would argue with me about this, but for these couples, a lot of times we need a basis for how we're understanding what we're up against here. Because the experience of a gay man married to a straight woman compared to a bisexual man married to a straight woman is very different.
Yeah. I was gonna say something else, but since you left off on there, can you tell us that?
Well, we
I
see
mean,
in
I know
these.
it's sort of obvious, but like, yeah, what's the
Sure,
difference?
sure. Yeah, so we typically see men that are bisexual have higher levels of satisfaction in their relationship with straight women, whereas men who are maybe more explicitly gay report a much lower satisfaction in those relationships.
That makes sense. Yeah. And also, like, it also makes sense what you said before about couples therapy and individual. It's like, especially if people are coming to couples therapy having just disclosed or an affair has come out, like, the guy may not fully understand himself at this moment, as if this is like a new thing that bubbled up. It took me years to read stuff online and figure out what I was and go to discussion groups. And thankfully, I wasn't in a long term marriage at that time. So I could just navigate it on my own without having to worry about like how this affected a current partner. And like individual therapy was really helpful and necessary for me to come
Absolutely.
to an understanding. And I did that for a while before I started coming out to anyone. And so to just jump into couples therapy without the understanding yourself, I can imagine that that would be trickier to navigate. And there's an education component of just like, level setting or something.
Oh my gosh, absolutely. And unfortunately, you know, as the counselor, you're doing this education with so much shame that's been, is just touching all aspects of the couple. You
Yeah.
know, shame that like, how could I have done this? Who am I? And this is for both the husband and the wife. And and so it's you're trying to offer your best education and understanding of what's going on, but at the same time, like you're doing so much just de-escalation of like, we don't. This doesn't mean the relationship has to end. Like everybody can take a breath, but because again, there's just so much shame involved.
Yeah.
It feels like that's not an option.
Right. So much shame and also potentially tension between them and worry about what's next. And like sometimes it just takes some time to figure out where you are and who you are before you can decide what's to happen next. Like, do you recommend people let's say people are in that situation where this has just sort of come up suddenly, or maybe for the wife more suddenly than for the husband, like, do you recommend they go to individual therapy first? Do you recommend they do it in conjunction? Like, what's your advice?
I mean, yeah. So, I mean, as a marriage and family therapist, I'm always going to lean more towards relationship work. But let me be very clear: individual counseling is so important during this time. Um, and again, not just with other counselors. I mean, yeah, I'm always looking for referrals to send, you know, uh, the couple out individually. But for me, I mean, I'm needing to meet with each partner individually. I mean, it's imperative, and
Mm,
the reason why I mean is, I can't tell you the heartbreak that comes from you know working with a husband who is just so embarrassed and so shame and ridden with shame about understanding this piece of identity while his grieving significant other and wife is sitting in the room.
yeah,
And so as she's listening to him uncover the parts of his identity and going down, who him understanding who he is, and I mean essentially coming out of the closet. I mean she's just melting. And it's horrible. It's horrible to watch that process. And so as a
yeah,
counselor, you have to be really attuned to that. And if that reactivity is taking place, I mean I'm very quick to separate a couple and say, hey,
mm,
I'd like to maybe meet with y'all individually just for the next few sessions so we can get a couple things understood and we can kind of get on the same page. Because again,
interesting.
there's just such a tension behind, like we can't we can't be anything other than straight heteronormative. We have 3 kids. We go to church. Like we can't do anything else.
Yeah, fascinating. Do you when you do that, like, how do you now is there any triangulation that you do, like when you if you hear something from both sides of this that they maybe can't yet share with each other but they can feel comfortable sharing with you, how do you navigate like relaying that information? Is there any ever sometimes like you share it instead of them sharing it with each other, or do you facilitate, how do you facilitate them sharing it with each other?
Oh my gosh, absolutely. I mean, obviously, I want to promote a sense of agency for both parties here, um, but I mean, there's been multiple times where both parties have just said, "Can you just help me communicate this? I can't. I don't know how to do it." And so, of
Mm,
course, there's a lot of that going on. But I would also say, like, as a couples therapist, like I'm constantly in the middle of things. I mean, one of my jobs is to be a secret keeper, and it's not to mean that like I'm trying to be manipulative or deceive, but I mean that's just kind of the essence of being a third party witnessing a couple go through what they're going through. So individually, and this is unfortunately a phenomenon that takes place here, or again a characteristic. It's just the difficulty with extramarital involvement. I mean, I'm spending a lot of time individually with the husband asking explicit questions of like, are you currently sexually active? Like, are you currently engaging with other men? Um, Obviously, from a relationship perspective, I'm wanting to understand that, but too, from a health perspective, I think these statistics, but closeted gay uh, and bisexual men have the highest transmission rates of things like STDs and HIV.
mhm,
And again, I would say the reasons why we would suggest that's the case is that one, the shame aspect. They're not going to go to a free clinic and sit down and talk with uh, a medication or a medical provider about their sexual behaviors, and so they engage in these risky behaviors, and they put themselves and their wives at risk. So I really have to understand that because I mean, and this is not uncommon and this has happened multiple times in session that I am encouraging the husband that we have to tell her about these things because she's at risk for some type of transmission of disease or infection, and things like HPV can be very asymptomatic, um, and it's really detrimental to women. It can easily lead to cervical cancer, and again, that's a common STD, or virus that can be transmitted. And so we have to be looking at safety in
yeah,
these instances. And I cannot tell you how intense the shame is when the husband shares this, and then his wife has to go get a drug screen, and she's positive for things like gonorrhea or syphilis,
mhm,
and or maybe has contracted things like herpes,
yeah,
and I mean, again, the husband is just ridden with shame. But again, it's my job as a therapist to make sure that you know those things don't continue, because I mean we got to keep people safe. I mean, there's nothing like being in therapy for 3 to 6 months and then all of a sudden a couple discloses that one of them's been having an affair the whole time. You just go back to square one. So you really gonna have to flesh those things out at the beginning.
right, right. It makes sense that like shame about your sexuality or practices would lead to not getting tested, but like then the shame of what can happen from that is probably like 10 times worse, and it makes sense. So everyone go get tested. It's you can do it for free probably. You can get on prep. I get tested every 3 months. It's easy. Go do it.
And it can
Um
be free.
Yeah, I mean, for if you have insurance, it probably is free, and there are probably if you don't, there are places you can do it for free, and
Mhm.
confidentially. So at the very least, start there. Um, it's good for you too. If you have something, it's good to know. I get the shame of it, but what is. Find out. Okay, before we move on to you and your story, which I'm curious about, like is there anything else you want people to know about like the counseling experience, or is there anything you want counselors and therapists to know about if a client like comes in like this, or a couple comes in?
Um, I mean, I mean, yeah, I mean, for sure.
I mean,
Like,
we could talk for an hour probably about this. And if stuff comes up later, that's great. But yeah, what
yeah,
comes to mind?
I mean, first off, I just would say like, uh, as a counselor, like, don't uh, don't work outside of your competencies. You know, we're ethically bound by that, and you know, mixed orientation couples are not like essentially a protected group, but in some essences, they're a minority, and so you should have some additional knowledge or education about what's going on here. You know, if you don't feel like comfortable, you can do more harm by faking it. You know, make an
Mm,
appropriate referral and reach out to other providers in your area who maybe do work like this.
mm, cool. And if you're navigating this, go see Dr. Joshua Gebhardt for couples counseling and come see me for individual coaching. Perfect. Don't look any further. All right. Well, okay. This is wonderful. I kind of feel like this is going to be a two-part episode, and this may be
Sure.
the split point. So listeners, if you're hearing this, come back next time to hear Joshua's story. And thanks for listening to this episode. And yeah, okay. And now we'll just get right into your story. So here we go, part 2. Stay tuned for part 2 next week. Two Bi Guys by One Bi Guy is produced and edited by me, Robert Brooks Cohen, and it was created by me and Alex Boyd. Our new logo art is by Caitlin Weinman. Our music is by Ross Mincer. To help support this podcast, visit patreon.com/Robert Brooks Cohen. You'll get full video episodes, early access, and bonus content. Visit robertbrookscohen.com to learn more about my coaching, my book, and my stand-up comedy. And thanks for listening to Two Bi Guys by One Bi Guy.